We do a little of ABA, but not a lot. But we're doing more of it since we've actually started up a BCBA training program. We have psychologists who do both diagnostic assessments, and they also do a very unique thing, which I really love, and they're really the only folks in the state of Kentucky that I know do this. Our psychologists do what's called a clinical intake. These psychologists have been working in the field of autism, some of them for 20 years, some of them for 10 years, okay? And so most of what they do is they do a comprehensive look at, A, what has your diagnosis been, okay, in terms of what does your paper say for diagnosis, what are the child's strengths and weaknesses, and what has he responded to in school and not has he responded to in school. And they also take a look at the current therapy, whether if you're newly diagnosed, they make recommendations for therapy going forward. If you've had therapies before that have not worked, then they ask you questions and they make recommendations about, okay, well, is there something else that we can do? So they take a holistic look at really all of the therapy supports, whether it's been cognitive behavioral therapy, occupational therapy, any sort of speech and language therapy, and then they also make referrals to medical doctors in terms of the types of comorbidities that we treat. Go ahead. So one of the unique things, certainly as a resource, and certainly we want it to be a resource here for U of L Pediatrics, is of course our medical consultation that we can provide. Now within the Autism Center itself, we have a dedicated developmental pediatrician who's been around for a long time. Her name is Dr. Gail Williams. We have a child psychiatrist who some of you all may know. His name is Dr. David Lord. And David spends about 50% of his time with us. And of course there's yours truly, who my specialization actually is seizures. Okay? Now 30% of all kids with autism actually have seizures, recurrent seizures / epilepsy. There are only 3 doctors in all the United States that actually know something about that subject. Okay, so you won't find any west of the Mississippi. So, so we've actually got some very unique resources that we can really help with in terms of our kids. Now we do do a lot of different types of medication management. Certainly we do that on site, okay? We certainly do that over the phone, but you all have also heard a little bit about telehealth already, and we do that already for the neurology clinic here, and we certainly will be doing some of that at least for the autism clinic as well. I think somebody said, well, why is there a gap between, when's your last clinic in November? It's November, and then it starts again in March.
We had problems with winter.
Yes.
Driving.
Yes. So what we're going to try to do at least is I'm going to promise you guys that I'm going to try to make it down here once during the winter time. Okay, but if we can't, okay, well at least we will have the telehealth that if folks can actually make it to the commission clinic, okay, then we'll be able to do that.
Yeah, let me correct.
Okay.
We do have telehealth clinics during the winter.
Yeah. I mean, at least we have the telehealth, but I'd like to try to make it down here at least once, you know. But we may have to be a little flexible about that. So, yeah, this winter was pretty doggone wicked. Even in, I mean, I'm sure it was really wicked here, guys. I know it was really wicked here. But even in Louisville, we had a lot of different problems. So much so that I'm going to be buying a new 4-wheeler in the fall or early winter. I mean, if I'm going to get here, I've got to have something. My Civic is not going to make it. I love my Civic. It's been a great car for 10 years. So this slide is just really meant to emphasize that our biomedical approaches really, why do we try to attack these, including sleep and including GI issues, okay? So it turns out that if you look at things like seizure volume or you look at sleep parameters, that there's a very nice correlation between that and increasing difficulties of behaviors, okay? You can actually prove this scientifically. Every parent in the room knows this. I'm not telling you guys things you don't know, okay? But in order for us to justify actually spending a lot of money treating it, we have to say, okay, well, this is what it's going to affect, okay? And it turns out that sleep and seizures and GI can be a huge source of problems. In fact, I can tell you many different stories of where I made somebody seizure-free, or we treated somebody for their reflux, or we treated somebody for their sleep, and it was a totally different kid.
Absolutely.
Totally
I speak truth
different
to
kid.
that.
Yeah, totally different kid. So, and that's, yeah, and you may or may not use medicines for that, guys. That's the other thing. I mean, you know, sometimes for instance, correcting sleep, okay? Correcting sleep may just be a matter of sleep hygiene, okay? Your kid can't get to sleep because he's got, you know, 3 iPads going and 2 videos game going, and he's perseverating on the Pokemon until 2 o'clock in the morning and all that. You know, there are behavioral approaches where you can take care of that, and suddenly your child is actually sleeping again through the night. And the daytime function is much better during the day. There's actually very, very discrete neurobiology mechanisms, which I won't go into, that actually sort of link those tubes, sleep in the night with function of, say, the attention system during the day. But anyways, it's certainly both mechanistically and then functionally for patients, it's a real big problem that needs to be corrected. Okay, go ahead. So we also have social skills groups. We have summer camps. They're all, of course, mainly trying to build communication skills with peers. We also have started a number of boys night out groups, as well as we've started a lot of, well, there's 2 or 3 groups now targeting young adults with both communication as well as life skills. So we actually have within the center itself, we actually have a whole kitchen, as well as a washer and dryer and refrigerator and all these sorts of things. So we actually we actually sort of we have sort of functional daily living skills sort of centered around that social skills training. So, and it's proven very successful and very popular. I've actually had to add groups every 8 weeks. Have been so popular. So it's really terrific. And certainly that's something that a lot of different families will need around here. I've heard some providers are providing that, which is great, but you know, with the numbers of kids that are around here, you may need many more groups. Okay, go ahead. So this kind of gives you an idea of what the trajectory for the autism clinic in Paducah is going to be. So you'll start with a lower number, and then 2 years later, you'll be at 5 or 6 times the number. So if you build it, they will come. So
I say that to these women all the time.
okay. So Belinda, put on your roller skates, okay? Put on your roller skates, because it's gonna be something. Anyways, this is just our growth through 2013. We're already at 7,000 for 2014, and we're only halfway through the year. So it's been tremendous. Some of that, of course, is me going out and talking to folks, but a lot of it is just literally, Louisville is one of these cities that has grown by leaps and bounds, and all of the growth is in the childbearing age groups. Okay, so the Children's Hospital is just busting at the seams, and every single night it's full. And it's much like Vanderbilt. Vanderbilt has the same problem. And the other thing that's frightening about all of this is that all of these figures, of course, are, you know, if you look at the trajectory of the number of kids who keep getting more and more identified, these numbers are going to go up exponentially over the years. So, and it's 1 in 50 right now. It's actually not 1 in 63. It's 1 in 50. It's 2% of the population now. the latest numbers for 2013. So. Okay, go ahead. So we have a number of different things that we have put into our strategic plan. Each of those are centered on our major missions: diagnostic excellence, treatment excellence, excellence in science, excellence in collaboration. I just put this up here just because this sort of is kind of a case management sort of. It illustrates what I really like about case management and the concept of these regional autism centers. So, as I pointed out many times, our nurses at the commission clinic really take hold of these families, and they really follow them through each thing and everything. The thing I love about you guys is you know all the families, so whatever things are going on, you know, it may not be something that mom and dad mentions to me, but mentions to Belinda, and she tells me, which is great because it helps me to identify a stressor that's causing the behavioral problems that, you know, the family doesn't necessarily tell me about. So that's important. Timely diagnosis, of course, is very, very important. Our goal, what we wrote in the strategic plan, is we want everybody to come in for referral for diagnosis within 30 days of referral.